Welcome to the March edition of 71 Magazine. I'm your host, John Bryant, and with me today is Jeremy Bradford, who is the CEO of Hospice of Western Kentucky. Jeremy, welcome to the show, and really welcome back to Owensboro.
Thanks, John. My wife and kids and I are glad to be back in Owensboro. It's nice to come back home, and we had an opportunity to go to Florida and work with the hospital there as far as VP of Ambulatory Services. With the experience that I had at Owensboro Health, which was great. As you know, I started with hospice years ago, and we're back home.
Well, it's kind of a full circle then.
Absolutely. And you know, the unique thing about it is it's amazing just the number of people that have reached out to both Jenny and I to talk about how glad they have us back in Owensboro and back at hospice.
Well, it's very nice to have you back. And
thank you.
And as a friend of yours, I'm glad to see you come back to Owensboro.
Thank you, sir.
Well, let's talk about the mission of hospice. It's helping individuals live with dignity through the final stages of life.
Absolutely. There's two key points I really wanted to point out there is living life. Living life is so important for us as hospice providers to articulate to the community, because all too often the misconception is that hospice is just about the final days. Right. And really it's important for us to get out to the community and to the service areas in which we cover to talk about you need to engage hospice earlier. Because the number one comment that we get from families is we wish we would have called hospice sooner. And we can really help with not only the patient, but help with the family, because it's about the continuum of care. Right. And that family is a very important piece of that.
Yeah. Well, I'll tell you, I would be surprised if any of our viewers who might be watching this hasn't had either a direct or indirect contact with hospice at some point.
Absolutely.
I know I have on several occasions. And, when you say, wish you would have called them in earlier, that's very true. And that's something that I think people need to realize, is that there's nothing wrong with reaching out early to see if they qualify for hospice to come in at an earlier stage, because what hospice does really is it doesn't extend the life. I think it just makes the life more meaningful through the end. So yes, a very, very good point. Now, we just talked about, but many people think that hospice is just for the terminally ill of cancer.
You're exactly right. Only about 40% of our patients have a diagnosis of cancer.
Wow.
So that leaves 60% that falls into the category of liver disease, heart disease, dementia, and kidney disease. So there's many different diagnoses that we care for outside of cancer. But all too often, again, with the misconception of the final phase or final days of life with hospice, it's all about cancer is what people assume and what they think. So it's really important for us to go out and educate the community every opportunity we get, and that's why we wanted to meet with you all today to talk about hospice in general, but also kind of address the misconceptions that are out there.
Yeah. Now, has that always been the case with hospice? Have they always gone in for other things other than cancer? Absolutely. Oh, okay.
Yeah, we've seen the percent of patients treated with cancer decrease a little bit more, so we're starting to see other areas, and that's just education. People becoming more familiar with hospice services and what we can do.
Right, okay. Now, when hospice is asked to care for an individual, it really is a team approach.
Absolutely. And in that team, people trust a number of different individuals within our organization with their loved ones and with their family, because oftentimes they're inviting us into their home. And we'll talk a little bit, hopefully, about what the home definition truly means. But we have spiritual counselors, bereavement counselors. We work and collaborate with the patient's physician. We have a team of nurses that come in and work with the patients and the families, certified nursing assistants, volunteers. Volunteers play an important role in our organization. It's a mandate by Medicare that volunteers play at least 5% participation within our organization for the overall continuum of care and care to our patients.
Okay. So people can keep their doctor?
Absolutely.
Okay.
And they can work very closely, their physician can work very closely with our medical director. And we would collaborate just with that patient's primary care physician. Okay.
Now, let's jump over to where will hospice go to offer their care services?
So the home is defined as it could be a loved one's home. And 9 out of 10 patients prefer to be in a home setting when dealing with end-of-life issues. And that home could be an assisted living facility. It could be a nursing home. We provided services in the hospital. Or it could be in the patient's own home. And the one thing I wanted to point out is something new that joined our organization a little over a year ago is the Harford House. We really developed that center. The board of directors had a vision the organization had a vision that in Western Kentucky we needed a freestanding hospice inpatient unit for to meet acute care needs. So we have a 13-bed facility on Old Hartford Road that many patients come and receive services. It may be routine care where they just come and get routine care and go back to their setting of choice. It could be respite, because the one thing that I want to point out is all too often people give all of their efforts to their loved ones as related to care. But oftentimes if they don't take care of themselves, they can't take care of their loved one.
Right.
So we offer at the Hartford House 5-day respite where patients can come. We can work with them as far as the transition from their home into the Hartford House for a 5-day respite. The caregiver can get some relief, run errands, take care of bills, do things of that sort, and put their loved one in the care of nurses and staff for, that provide care 24/7.
Wow. Now, is there, and I'm going off script here a little bit, but is there any plans to maybe in the future expand that 13-bed facility?
Well, we're evaluating it right now. We're continuing to increase the awareness because we currently serve 4 counties.
Okay.
But the thing to note is anyone outside of the 4 counties could still benefit from the Hartford House. So there are no geographic boundaries related to the Hartford House. So we have people who come from out of town who may have loved ones in Owensboro, and they want to come and take advantage of the Hartford House. So you don't necessarily have to live in our 4-county service area in order to take advantage of the Hartford House.
Okay, what counties are that you serve?
Okay, it's Davis County, Hancock County, Muhlenberg, and Hopkins County.
Oh, okay.
We recently added Muhlenberg and Hopkins County to our service area.
Oh, all right.
Yes.
Who was serving them previously? Or?
Well, there's another hospice. Baptist Hospice serves both Hopkins and Muhlenberg County. So we went in to help complement the services that they're offering there.
Okay.
Yes.
Okay. So how does hospice get paid for the services? Because let me tell you what, in my experience with hospice, there's a lot of people who come in. There's a lot of services that are provided. Who pays for that?
Medicare and Medicaid primarily. We do contract with most private insurances to provide coverage for hospice patients, but primarily it's Medicare and Medicaid. The one thing to note is we do not turn anyone away due to their inability to pay.
Right.
We're a nonprofit organization governed by a board of directors of 17, and they too have the mission of providing services regardless of the ability of the patient to pay. So with that, we really have to do a lot of public education, and we do fundraising. We have our big fundraiser coming up on March 28th, the Run for the Roses. It's a derby theme at the Owensboro Convention Center, and that's our largest fundraiser. We're really looking to not only raise money but to increase the awareness of hospice services. But when we take on a patient, oftentimes the cost of caring for that patient far exceeds what we're reimbursed. So we really rely on donations and contributions and fundraising to help us offset that.
Okay, and I will say publicly that your fundraising events are a lot of fun.
Well, thank you.
Yeah, I've been to several of them, and they really are a lot of fun and certainly good, a great
Thank
cause. Well, let me ask you this: I've always been under the impression that only a doctor, a physician, can refer somebody to hospice, and I understand that's not true.
No, it's not. Anyone can refer. Oftentimes we would have a family member refer, clergy, and we may have a neighbor. They may call and they may be very close, whether it be a relative or a close neighbor, and say, we know that we have a family member or friend who may need your services. I've had conversation with them and they're comfortable with me calling. Could you come out and just evaluate? And that's the thing about our organization. If the patients aren't appropriate for our type of care, we would refer them on and work with other institutions or organizations to help get them situated with the appropriate care that they need.
Right. Okay.
And that's the one thing about it. Anybody can refer. However, it does take a physician's order in order to admit into our program.
Yeah.
And we would collaborate with the patient's primary care physician and work with our medical director at hospice.
Okay, well that's wonderful. Now, we did talk about volunteers earlier, and I know that hospice does utilize volunteers. What areas, I guess, of volunteering are available?
Well, those areas expanded when we added the Hartford House. So we have patients deliver flowers. Volunteers deliver flowers to the patient's home. We have volunteers come in and help with administrative duties, mailings. We also have volunteers answer the telephones at the Hartford House, as well as round with patients. There's a couple new programs that we're excited that we're going to be rolling out, hopefully in the coming months, and volunteers are going to play an important part of that. It's about embracing the community into a community organization. And all too often, people don't necessarily understand how they can get involved.
Right.
And we have a dedicated bereavement coordinator that coordinates all of the care, whether a volunteer may be going and sitting in a patient's home with the patient for caregiver relief, or just being a vet, a fellow vet going in and working and sitting with another veteran to talk about, you know, how things used to be and kind of reminisce. So it's those special type of arrangements and friendships that are developed through our volunteer program.
Yeah. Well, listen, Jeremy, how can folks get additional information either from you or just about hospice in general? How can they get a hold of someone?
Yes, we would encourage. We're currently redoing our website. It's currently under construction. You'll see it as it states today, but it's going to be changing in the coming months. But also we have a Facebook page. A lot of people are using social media today as far as a means of communication and getting information, so we would encourage people to go to our Facebook page. And at the same time, we would ask them just to call the office. All too often people err on the side of not calling offices, just to pick up the phone and call us and say, can I come in and talk to you about a loved one that may need services, or a friend. We would sit down one-on-one with you with our team of professionals and be happy to address the needs that they may have.
Okay.
Yeah.
Listen, before we go, I want to have you on again sometime, because I think there's some of the things that I have learned through having interaction with hospice is the process of the end of life.
Right.
And I think there's some incredible myths out there that you know that need to be cleared up with some folks, and just knowing them personally, I think it would make for a great segment and be very informative for folks. So I'm going to invite you back sometime.
Would be happy
and come back, and we'll kind of dig a little deeper into that. So, but anyhow, thanks for joining me.
Thank you for having me.
I appreciate it.
Yes.
Stay tuned. Up next, we're going to have some folks from GED here at OCTC. So stay tuned. We'll be right back.